नमस्कार. अलर्ट, ॲक्टिव्ह अँड अलाइव्ह ॲट 100 ह्या कार्यावळीन तुमचे स्वागत. डेम्पो हेल्थकेअर प्रस्तुत ही कार्यावळ आम्ही स्वर्गीय श्री विश्वासराव डेम्पो यांच्या यादीन राबयतात आणि दर शुक्रारा रातचे 10 वरांचेर आम्ही तुमच्या बरोबर असतात. आरोग्य आणि स्वास्थ्य हे विषय घेऊन त्याबद्दलची चर्चा करपाक. हाऊ टू लिव्ह अ लाईफ that is stress free, healthy, how to remain alert, active and alive at 100, and this is what we discuss in each and every episode. Well, we have with us Dr. Digambar Naik. Namaskar, doctor.
Namaskar, yeah.
Welcome to the show. Dr. Naik has been a renowned heart specialist from Goa and whose name has already been recognized as one of the 50 pathfinders of the Indian healthcare industry. Well, Dr. Naik has written a book namely Alert, Active and Alive at 100. आणि त्या पुस्तकान ताणी जे बरयल्ली सूत्रां आसा, the lifestyle that he has mentioned that we should live and attain our healthy 100 is what we discuss in this show. दर एपिसोडान आमी वेगवेगळे विषय हाताळतात जे ह्या पुस्तकान बरयल्ले आसात. पण त्या विशयाकडे वळच्या पयलीं आमी डिस्कस करतात ते आमकां जे प्रश्न तांच्या डॉक्टर नाईक हांकां जे प्रश्न विचारले वतात व्हॉट्सएपाद्वारे नाजाल्यार तांच्या पेशंटा कडून जे प्रश्न येतात त्या प्रश्नाची उतरां आणि त्या प्रश्नां बद्दलचे डिस्कशन आमी ह्या शोन सगळ्यात पयलीं करतात. Now there is a little twist in today's discussion because we are going to discuss a particular case that has come to Dr. Naik. Well, doctor, you were discussing about echocardiogram, which has been an important diagnostic tool these days. बरेच वेळा असे पेशंट येतात की ज्यांका ऑलरेडी एंजिओग्राफी प्रिस्क्राइब केल्ली आसता, एंजिओप्लास्टी करपाक सांगिल्लें आसता आणि ते करून सुद्धा पर्टिक्युलर डायग्नोसिस जायना. So what do you say is the importance of echocardiogram in the current era of cardiology?
Okay. आम्ही सुरुवातीकूच बॉडी आम्ही एक गाडी एक कंपेअर केल्या.
Right.
ओके. मेकॅनिकाकडे जर गाडयेचे इंजिन काढून दिले न्ही तो त्या गाडयेची सगळी हिस्ट्री सांगतलो. अमकी वर्सांची गाडी अमक्या भशेन चलयल्या, मल्टिपल हातांनी चलयल्या, कशी मेंटेन केल्या आनी कितें केल्या ती. Okay, our heart is the engine of a body.
Right.
And when you do an echo, you put a probe on the heart. This is the ultrasound of the heart, and you see the heart thoroughly well. Complete circuit, heart, different layers, at the bahir, bitar, complete. It's as if heart is taken out and you have sliced it and you opened it completely and you are seeing it inside. When I do an echo, I am able to see the heart to that level. त्या हार्टांसून रगत कशें चलता, त्या हार्टांसून हार्टाचे मसल कसो आसा, मसलाचे कॉन्ट्रॅक्शन कशें आहा, मसलाचे रिलॅक्सेशन कशें आसा, कितली हार्टाची सायज कशी आहा, कितले रगत खंय येता आनी कसल्या वाल्वांसून खंयचे रगत कशें भोंवता, कितलो प्रेशर प्रत्येक चेंबरान आसा, वाल्व whether it is stenosed or बारीक जाला काय लूज जाला, it is called regurgitation. हे सगळे वस्तू I am able to see it when I put my probe onto this. With the result, what happens? The understanding of the heart is complete. आता आमी ECG करता न्ही, जेन्ना आमकां इको नासलो तेन्ना आमी ECGचेरूच I remember we used to treat patients. When I began my practice, echo was not there. Last 15 years I am doing this echo very regularly. At the last 3-4 years at least, now we say every patient when we are writing a prescription of the heart should be seen on an echo. I would also say every patient before he goes for any operation you should see on an echo. Or any patient before a chemotherapy. In America there is a separate department, chemotherapy patientak diवच्या पयली, before each chemotherapy एक cycle दिवच्या पयली you have to have the echo report. Because that will tell chemotherapy has a bad effect on the heart and ती दिवच्या पयली कितें जाता हे दाखयता. And so only when the heart is cleared on an echo, second episode of chemotherapy is given. आम्ही खूपशे आयकता, खूपशे youngsters have died whilst playing. 20 ते 30 वर्सांचो भुरगो जो फुटबॉल खेळटा So he scores a goal and suddenly he collapses and dies. What number as have already increased more than 100 in the last 25 years. Why should that young boy die? He has died because he had some problem with his heart which was not recognized without doing an echo. A lot of diseases, we have hypertrophic cardiomyopathy, some tumors, some valvular defects, some what is called as a systolic function defect, contraction defect, or a relaxation defect. The heart has to relax to get filled, then contract to throw the blood out. ये दोनों वस्तु जना systematic जातले, only then our heart will stay with us for a whole life of 100 years. It cannot stop. It starts beating from the womb. At the 6th week of the baby inside the womb, you can actually see the heart beating, and till we reach our tomb, it has to beat. So you can imagine the importance of that heart. So whenever there is a defect, and when you exert it, when you overstrain it, it can land up into problem. If these youngsters, everybody, let's take up people on sports. Everybody, if during sports thing, if I do an echo on them, or if a doctor does an echo on them, he will be able to select and find out
Spot the future.
and spot the future. Yes, this boy cannot go for sports, or this boy can go for particular sports, or this boy can go for any sport. And there are these defects which are there. Defects are there in a heart, plenty of them. Okay, today we recognize the defect of a heart even while the baby is inside the womb, and we even rectify it there.
Through echocardio.
Through echo. For all this, it is echo. Echo is a.
So you say it is the first step towards recognizing any cardiac ailment that is going to happen.
Absolutely, and recognizing it almost perfectly.
Right.
See, when we today everyone talks about chest pain, ECG, and angiography.
Right.
Angiography means we are only checking the arteries, the 3 arteries
And
of
the
the heart.
blockages.
We are checking it, and how the heart pumps the blood. These are the only thing we check, and we find if there are blockages, and then we rectify the blockages either through angioplasty or a surgery. But echo is one thing. The heart has got many other things. Artery is one part of it. The heart has got nerves. The heart has got epicardium, the outer layer. It has got a pericardium. It has got a myocardium, and it has got an endocardium. 3 layers. Besides, it has got these valves. Okay, and all of them have a different complex attachments. The valve loss of the defect aslo, that defect might cost you your life if you.
And that can be recognized through echo.
That can be easily recognized through echo. We can see at what stage the heart problem is, which we usually put it as mild, moderate, and severe. Like a patient is going for surgery, I can know on an echo, I can know this is the problem this patient will have in surgery. You have heard about patient going for simple appendicectomy,
Right.
and on the table patient develops a cardiac arrest, and the patient does not come out. So many cases have happened. Okay, but if you had to do an echo, you could have realized that there is a particular problem there, and through this problem, once you recognize, you know how to take care of it.
Right.
Okay, so it becomes very, very easy. Today, almost all the anesthetists, good anesthetists, will ask for an echo before doing a surgery. In fact, now that echo the anesthetists have also started learning about echo. There is an echo machine in most of the operation theatre today. The anesthetist will put the probe and see the patient's echo, and then plan his anesthesia as per that. Suppose there is a heart attack, you can see which portion is getting less blood supply or no blood supply, or which portion of the heart muscle is dead, and how it is, how is it functioning, how is it not functioning. All these things can be beautifully analyzed. Like a tumor in the heart, you have a cancer here, you have got a secondaries in the heart. That's only way to know. So echo
Very
today
interesting.
is, I would say, is I would call it as a basic.
Right.
Yes, I have learned
Basic
it.
and the most important one.
Basic and the most important to guarantee anything which is safe to you. When I'm talking about living safely without any problem for 100 years, you're not taking any chances with your life.
Right.
When you're going into sports, a competitive sports, when you're going into a competitive sports, you don't know how the people work. Like you see IPL these days, one little fall and they've even torn their muscles.
Right.
Because that is the intensity with which he's diving, that is the intensity with which he's moving. He sees the ball coming, he knows from here he has to jump and catch that ball. You know, the force that he puts to eject himself to that level at that moment is absolutely unbelievable. Today it is unbelievable. They are making their body work like almost miraculously, I'm telling you.
Right.
We were just watching the match yesterday.
Yeah.
The way Virat Kohli was playing, every ball practically going to a six. No, unbelievable stress and strain on your human body.
Right.
And
And not only in sports, in many things.
Everything.
Everything, even
today.
in our work, even in studies.
Absolutely.
So I think by knowing about echocardiogram, we have known much about, you know, how we can prevent
the whole
ourselves.
engine, the whole
Right.
engine.
Right.
And that is where you look at it. That is where you spot it out. That's where you know how to take care of your
Right.
things subsequently.
Yes, and diagnosis is the first step of treatment.
Absolutely. Without diagnosis,
You
say
cannot go ahead.
If your body has a particular problem, I must rectify it for me to give you a complete life.
And once you are convinced with the good echocardiogram results, then you are also stress free.
Absolutely, and it is
So
predictive.
things are ruled out. And
Looking at an echo, I
right.
can tell you, if you don't take care of yours like this, you can't live for even 4 years, 5 years. It can be predicted
Oh, yes.
and cured and
Right.
taken care of.
Right.
So that's why today I would say echo should be one of the most important tests each one of us should undergo when we develop any problem, including a fever. Many times you don't get the cause of fever, and there could be a small infection inside your heart. And if you allow that infection to go inside the heart, it will start eating away the valves. And then if a valve is damaged, obviously that heart will not last longer.
Right.
Okay, heart is pretty complex, and that complexity is to be kept straight. And if you understand this, we know how to treat it.
Yeah.
Everybody knows how to treat it. But what is important
Is to know.
it
Right.
thoroughly well. It's
Yeah.
like taking an engine, like a mechanic takes an engine, then he knows it. If you look at the heart, yes, I can predict how the man has been living, how many
Beautiful.
years he has a blood
Yeah.
pressure, how many years he has not taken care of himself.
This is very assuring information that you have given. Thank you so much, because echocardiogram, many people have questions about it, whether they should go in for it or not, because this is, for many, it is a new concept, it is a new diagnostic tool.
And it's
So,
easy and it's cheap.
yeah, so I think we don't need to fear about this big word. And now that you have convinced and told us about how trusted this method is, well, now that we have talked much about the heart, we should travel to our minds and see how we can take care of the health of our minds. And I think the discussion last time had come and halted at the mindful awareness.
Yeah, the stress, how
the
we live a
stress,
life
yeah.
with-
We were talking about stress-free life, and we have also realized that we cannot have a stress-free life, but at least we can make ourselves resistant or make ourselves strong enough to combat this stress or overcome this stress. And you were talking, right,
Say convert your so-called stress into
use stress, right?
okay?
This is a very important word that we have learned. Now,
Enjoy that stress.
right, enjoy the stress.
Absolutely,
Okay.
absolutely. See, you also had to come here had to do such a running around the whole day. If you had to smile through the rigors that you have done through it, I'm telling you, this rigor of the day will benefit you much more, your body
Right.
more
You know,
than otherwise.
this is very nice thing that we have